reach out to him, and he will. And the one who is more of a celebrity in terms of responding to members is Honorable Esther Nyakuni. It seems when you got her, you get food, you get what? But thank you for always opening the door for members. That's one I was saying.
I'm seeking for guidance. The previous presiding officer, the no speaker, directed Minister of Education to report this house today on the matter of the higher loan scheme, where they have failed to release funds, and indeed a number of students who applied for these loans are going to miss out. I don't know, Speaker, I am seeing Honorable Miingo seated there in the corner, very comfortable. So I am seeking for your guidance, because he committed this house last week, and the challenges to this loan scheme, Lord No Speaker, are very key. There is no board, but these students take loans and pay them back. We can't fail to run this loan scheme where we, as a Committee of Education, we gave them funds and they have only received 2 billion. So, Lord No Speaker, the guidance I'm seeking from you, whether through your guidance, would you give us an update and the finances here? Otherwise, students who applied for these loans are perturbed, they are worried, and university admissions are taking place. Right, No Speaker, that's the guidance I'm seeking from you. But he has come closer, right, No Speaker. I think...
Honor Miingo, it seems there is a way you are communicating with Sewungu, with Honorable Sewungu. So since you've come closer to the microphone, come and do it.
Thank you very much, Right Honorable Speaker. My Honorable Speaker and my dear colleagues, it's true there has been a delay to release the list of students who are going to be beneficiaries. And this has been so because the term of service of the board had expired. And as I talk now, a new board has been appointed and they have started work. Soon you'll hear the ministry releasing these results. Right, Honorable Speaker, I submit.
Thank you. So we hope you can expedite to cover for us time. It's very, very important. Next item.
Item 3, statements by ministers. Item 3, Roman 1, statement on World AIDS Day.
Honorable Minister for the Presidency.
Thank you, Right Honorable Speaker and honorable colleagues. Right Honorable Speaker.
Honorable Minister, you have a maximum of 10 minutes. I hope it's enough.
Thank you, Right Honorable Speaker. Right Honorable Speaker, this statement is on the commemoration of World AIDS Day. That is 1st of December, 2022. Right Honorable Speaker and colleagues, Uganda has made tremendous progress in combating the HIV and AIDS epidemic over the past 10 years. By end of 2021, Right Honorable Speaker, Uganda had estimated 1.4 million people living with HIV. AIDS-related deaths had declined by 67% from 51,000 in 2010, 17,000. And the new HIV infections had declined by 39% from 88,000 in 2010 to 54,000. That is Uganda 2021 HIV epidemiological estimates. In spite of the progress made, Right Honorable Speaker, there is still unfinished business. About 1,000 people get infected with HIV every week, and about 326 people die weekly due to AIDS-related deaths. Infections among young people, that is 15 to 24 years, accounted for 37% of all the new HIV infections in the year 2021, with the new infections occurring 3 times more among the young girls compared to the boys in the same period. That is Ministry of Health Annual Estimates 2021. Right Honorable Speaker and Honorable colleagues, the drivers of new HIV infections include multiple sexual partnerships, sexual and gender-based violence, negative social cultural norms and values, e.g. early marriages and widow inheritance, transactional sex, income inequality and poverty, high level of school dropout, stigma and discrimination, inequity in access to prevention, care and treatment services. Concerted efforts by all stakeholders are required to address these challenges. Right Honorable Speaker and colleagues, each year in December, Uganda AIDS Commission under the Office of the President mobilizes partners at national and subnational level to observe and participate in HIV AIDS advocacy events. Key among them is the World AIDS Day. These events provide a powerful advocacy platform that is well aligned to the Presidential Fast Track Initiative for ending AIDS as a public health threat in Uganda by 2030 and mainstreaming HIV for epidemic control. The Presidential Fast Track Initiative aims to ensure that nobody is left behind and promotes increased focus on proven effective interventions of HIV response and addressing prevailing gaps in coverage of key services in the country. Right Honorable Speaker and Honorable colleagues, currently Uganda, like other countries globally, is undergoing the post-COVID-19 pandemic recovery where services were halted due to the lockdown. The impact of COVID-19 were immense across the country, such as disruption of social services in education, health, livelihood, a rise of teenage pregnancy, increase in gender-based violence across the country. This therefore escalated the HIV infections among the young people across the country. Right Honorable Speaker and Honorable colleagues, the Global World AIDS Day 2022 theme is Equalize. Equalize is a call to action. It calls on each of us to do all we can to address the inequalities which are holding back progress in ending AIDS, and the national theme for this year is Ending Inequalities Among Adolescent Girls, Young Women and Boys. With the 2030 target in sight, it is a critical for everyone to reflect on their individual and collective responsibility towards ending AIDS in Uganda. The objective of this motion is to inform you and seek your support towards the commemoration of World AIDS Day that will be held on 1st of December 2022. The national commemoration will be held in Rukungeri district. As a country, we always commemorate this day to take stock of achievements in the fight against HIV and AIDS and rededicate more efforts to the fight against the epidemic. Right Honorable Speaker and Honorable colleagues, every year, Uganda joins the rest of the world to commemorate the World AIDS Day. His Excellency the President has since the early 1980s spearheaded the fight against HIV and AIDS in the country, winning various accolades at continental and global levels. Right Honorable Speaker and honorable colleagues, in 2017, the President launched the Presidential Fast Track Initiative to end AIDS as a public health threat in Uganda by 2030. Since then, the country has registered many achievements. It is therefore critical to have increased and consistent sensitization of the public about the prevalent risk of new HIV infections and what individuals need to do in order to mitigate the risk. Commemoration of World AIDS Day provides a strategic opportunity for engaging the public. This is even more timely because of the highly festive season where some people tend to indulge in irresponsible sexual behavior, thus acquiring HIV infections. Office of the President will provide oversight to Uganda AIDS Commission to ensure that community sensitization is intensified as part of the commemoration activities. Right Honorable Speaker and honorable colleagues, in conclusion, my prayer therefore, and to inform honorable colleagues that, number one, Cabinet has agreed that World AIDS Day takes place in Ilkongeri District Main Stadium. Number two, note that the preparations for the commemoration of the World AIDS Day 2022 have commenced. Number three, note that the World AIDS Day will be commemorated on Wednesday, 1st of December 2022 under the theme, Ending Inequalities among adolescent girls, young women, and boys. Number four, support the preparations for the commemoration of World AIDS Day and relay HIV messages across the country as national leaders to increase HIV awareness and advocacy. Number five, support the funding for HIV interventions to ensure we achieve the Presidential Fast Track Initiative for ending AIDS by 2030 in Uganda. And number six, to participate in the commemoration of World AIDS Day. Right Honorable Speaker and honorable colleagues, I beg to submit.
Thank you, Honorable Minister. Just a small correction. First is on Thursday, not Wednesday. So the answer should capture that correction. Colleagues, these statements, Rule 52 of our rules of procedure provide that we may discuss them. We've wasted a lot of time today. And recently we discussed a full report from the committee on HIV/AIDS. And there is nothing different, nothing new that is outside that same report, which was presented and given adequate time on the floor. So based on that, I will not allow debate on this. Now, when you say give 3 and you're standing up, it means you're number one yourself, and then the rest are suffocated. But before we do that, when we had a presentation from the Attorney General, the action taken report on Achori, Lango, and the Teso claimant, he gave us figures on the claimants who had been compensated, and the colleagues insisted that we wanted a full report with the list and all that. And he has prepared it. Let me give him an opportunity to lay it on the table.
Thank you very much, Right Honorable Speaker. Right Honorable Speaker, at the last session, the last sitting, we presented a report which is at page 18 and 19 of the summary of the payments made to Acholi Sub-Region, Lango, and Teso. As a request of the House that we present the actual list with the names and the particulars of the actual persons and the amounts that were paid. I beg to lay.
Thank you. The report is available. A clerk will say of managing it so that members can always. But The speaker is speaking and you're saying procedure. You people, why are you interrupting me? Allow me, I finish making my comments and then you speak. I think you're going to force us into organizing another induction because I'm seeing a lot of gaps. But I would request colleagues. Let me tell you, colleagues. Colleagues, let me guide you. I request you. Parliament is a full-time job. I need you to know that. Parliament is a full-time job that requires you reading. It's a full-time job. Here you're like pastors, you're like priests, you're like reverends. You can't be a priest, you can't be a reverend, you can't be a sheikh without reading a Bible or a Quran. Okay? I can't keep telling you every day on what to do. Number two, you must go back and you read Hansard's. Hansard's of the previous, you can even target a few people. You can do once in a while. You see how they were doing it because personally I'm doing it. That's how I'm able to move. Number three, don't get tired. Go on YouTube, watch debates in the African parliaments, in the UK, because we run the Commonwealth system, and then you will see a lot of things. Then we shall have a less disruptive session whereby when you're standing up to speak, you know you won't be interrupted, you will be respected, and then you don't have much interruption also from the presiding officer. That one I request as colleagues. So I'm going to arouse 3 people as you guided, and I will start with Honorable Gilbert Oranya. From that on a general. No, we are having a debate on that issue. But
Speaker, just a comment. I wish the Attorney General, thank you, to provide a soft copy. It's easy for us to access from the clerk's office. If we could do that.
Please, Attorney General, provide a soft copy so that we can upload it onto the system. Thank you. So I've allowed the Honorable Gilbert Oranya to.
Thank you, Right Honourable Speaker. Right Honourable Speaker.
Now,
Gilbert,
just a minute. Since I allowed Okupa Onzima from West Nile might cause problem that we allowed on a person.
Yes. Right Honourable Speaker, when the issue of compensation entered this house, we from West Nile, we have always wanted to raise this issue, but we have never got the opportunity. When you look at the atrocities caused by Kony, whereas the people from Acholi, Lango, Karamoja, and maybe Teso are being compensated. Yes, but the list is already been provided.
But whenever we have a debate on this issue, so couldn't your submission fall within the debate? Today, in a few minutes from now.
I hope you will give me that chance.
I will, Honorable.
Okay.
I will.
Okay, fine.
Yes, I can't debate myself. So, Honorable Tebandeke, procedure.
Thank you, Right Honorable Speaker. Right Honorable Speaker, the previous sitting, the Speaker ruled that the Attorney General also presents a statutory instrument extending the National Humanist Council tenure because the council is already in place but is illegally performing its task. Right Honorable Speaker, even the PDM, which is
now
ongoing.
you started justification.
Yes.
No, limit yourself exactly to the procedure matter.
So the council is performing illegally its duties, and the Attorney General, I thought he would delay that statutory instrument before even this, because it is urgently required. I beg to submit.
Yeah, but Honorable, you know, statutory instrument compared it to a list. A list is a historical document. He had it. The statutory instrument, he has to go process it, take it to cabinet, it's agreed upon. So, but I shouldn't speak for the Attorney General, only that I wanted you to get the difference for you to say it should have come first. Attorney General, you want to make a comment to satisfy the member?
Thank you very much, Right Honorable Speaker. Right, Honorable Speaker, like you correctly guided, that is the correct procedure to handle laws. And the law under which the Women Council was elected was made by this Parliament, and this Parliament did not grant the Attorney General the power to extend their life by statutory instrument. So with the instruction of the House, I have moved the matter in Parliament, in Cabinet, to request them to seek for an amendment and clearance from the House to be able to do the extension. I beg to submit.
Honorable Ranya, Honorable Tebandeke, you've heard the process is ongoing.
Thank you, Right Honourable Speaker. Right Honourable Speaker, I would like to thank the Honourable Minister for the report. Thank you. Honourable Minister, if you look at page 5, point number 5, where you are saying the presidential initiative support for ending AIDS by 2030 in Uganda, I really feel this statement should be corrected, because it's very impossible to end AIDS by 2030 in Uganda. We can end new infections of HIV/AIDS in Uganda, but you cannot end AIDS by 2030 in Uganda. And two, Right Honourable Speaker, I implore the Honourable Minister
So
to
it's
support.
not possible? You're prophesying or you're...
Right Honourable Speaker, looking at the number of years and those who are affected. So it's quite impossible. Right Honourable Speaker, and two, finally, I would like to implore Honourable Minister to support various organizations who are supporting people living with HIV and AIDS. For example, we have TASO in Gulu, their main office in Gulu, TASO Lera, TASO in other places. Right now, Honourable Minister, if government could support such kind of organization like TASO, I really feel the implementations of various government programs in ending HIV/AIDS more spread will be more easier.
Thank
I
you.
pray that you support those organizations.
Thank you. Vice Chair, Committee on HIV/AIDS, Honorable Kisa.
Thank you so much, Right Honourable Speaker and honourable colleagues. First of all, I want to thank the Minister for the statement, and equally for inviting members to grace this World AIDS Day that is going to be marked in Rukungiri. But Right Honourable Speaker, there is something the Honourable Minister has commented on, that the rise and the surge in the new infections of HIV/AIDS were mainly during the lockdown that increased to 54,000 Ugandans. And Right Honourable Speaker, as we talk now, Kasanda and Mubende, they are under lockdown. And the concern of the committee now, this situation in Uganda of lockdown, we are worried that we may have more effects of lockdown on HIV/AIDS prevalence and services in those two districts. And therefore, I want to urge government in the above districts to focus more, as they focus more on controlling Ebola. Right Honourable Speaker, we should have strategies that should be put in place to attain zero new infections, zero new AIDS related death, and zero babies born with HIV by addressing all of the factors that continue to increase HIV situations in Uganda. Finally, Right Honourable Speaker, there is only one other observation I want to make as a committee. During our interactions with the many stakeholders in the country, including the Uganda AIDS Commission, the committee has noted over time that donor support has been declining drastically. And currently, we only have the United States government through PEPFAR that is still on board. And it is only providing approximately $400 million. Now, Right Honourable Speaker, the committee notes that donor funds have largely been used mainly on vertical programs.
But Honourable, you're presenting again what you presented.
No,
this is the simple debate on the statement, and I gave you 2 minutes. There is a report. If you have a new report, come, I give you space, you present it.
Most obliged. I want just to mention one thing, Honourable Speaker, that this parliament passed a bill that came into law. And in 2014, the HIV/AIDS Prevalence and Control Act was put into, was passed by Parliament. And after passing it, we expect around in chapter 5 of this act, it provides clearly that the government should operationalize the AIDS Trust Fund. And my appeal as a committee is to request the minister and all people in government to ensure that the AIDS Trust Fund is operationalized. I want to thank you, Right Honourable Speaker.
Thank you. Yes, I will allow Rakai where HIV started from, then Honourable Beatrice Award.
Thank you so much, Right Honourable Speaker. Thank you, Honourable Minister, for this wonderful report. But I am very much worried when you look at the new infections being between 15 years to 24 years of age. That speaks to our school-going children. And when you look at the presidential fast-track initiative to end HIV infections, new infections, I think as a president's office and the Ministry of Education, you should work together, and we see that we have school campaigns because this is happening in our schools. Thank you so much. And then secondly, since HIV is where, since Rakai district is where,
when you're still submitting.
I'm sorry, sir. Since Rakai district is the birth, I'm sorry to say that, but that's what happened of HIV. We have lived with the bad effects up to date. And we are looking forward next year to have this celebrated in Rakai district because it will create more awareness and Chotera and information to you, Honorable of Chotera. You were asking for information? Oh, okay. So we pray as people of Rakai that we have the celebrations next year so that our people get more sensitized about the effects of HIV. Thank you so much, Right Honorable Speaker.
Thank you, Right Honorable Speaker. In the early time of HIV/AIDS, when people got to know about it, everybody was vigilant. Even on the radios and in primary schools, there were competitions, and we fought HIV/AIDS very much, reduce the incidences of HIV/AIDS. But now, it looks like everything is just quiet. It is almost like we are contented that we have already done away with HIV/AIDS. And yet for the young people, they think it is now like malaria or flu, treating flu. So it needs us to go again on our toes to fight HIV/AIDS very much. Sometimes government has time on radios. This time on radios should be used also to give messages on HIV/AIDS. Look, tomorrow next we have World AIDS Day, which is going to be commemorated in Rukunjiri. But you will find that most districts have not prepared, or most sub-counties have not prepared to celebrate, to commemorate this day. And yet it is the time that we should take stock of what has happened. Presidential initiative is very important and is very good, but there is no push, there is no funding to let us really put it on the ground. And please allow.
Thank you, honorable colleague, for giving me way for information. Really speaking, Right Honorable Speaker, as we do commemorate this day, I would like to inform my colleagues that the presidential initiative, as it needs money, Uganda as a government has a political goodwill to fight this disease, HIV/AIDS. And I really want to appreciate the president of this country for that. Thank you.
Thank you. I don't believe that we don't have funding. We only need to prioritize HIV/AIDS. If we prioritize, we will save our young people. Because right now, Honorable Speaker, you will find that at least there is prevention. Is there transmission from mother to child? There is already a way of preventing that
So,
transmission.
Honorable,
Why-
are you rejecting his information then?
No, I'm not rejected. I'm not rejected. I've taken his information, but I wanted to finish with at least knowing that we have a way of preventing HIV transmission from mother to child. That means that we can actually cut down completely the spread of HIV. If we are vigilant, we are not vigilant, we are not prioritizing, we are not giving funding to HIV/AIDS. Let us fund and let us also load it like tomorrow next. It should have been everywhere and on very many radios and also many TVs about HIV/AIDS to people. Even schools, although schools have been closed already, but it is important to have HIV sensitization back to schools, primary schools and secondary schools, where we have the spread the most.
Thank
when
you,
we know
Honorable.
about 15 to maybe 30. Thank you.
Thank you, Honorable. Rob?
Thank you, Right Honorable Speaker. Mr. Speaker, what Honorable, my colleague, the ever friend of mine from Luka, raised on the AIDS Trust Fund. Mr. Speaker, it is a creature of the law. It is vividly enshrined in the HIV/AIDS Prevention and Control Act. It provides for creation of a trust fund. Mr. Speaker, if you go through the figures provided by the minister in her statement, I've just calculated. It means we are losing 47 on average, 47 Ugandans per day to HIV/AIDS. And that therefore means we cannot nip it in the bud at the target of 2030, like the Honorable Gilbert put it. Mr. Speaker, even operationalizing if you go to, for instance, the AIDS AIDS Commission, in the national budget, always the budgetary allocation has been 25 billion. But what is always provided for the last 3 consecutive years is 15 million. Actually, the chairman of the budget committee, 15 billion.
Okay.
That in itself hampers and actually paralyzes the operations of the commission to do the oversight role and even the fighting against this serious disease of HIV/AIDS. Mr. Speaker, therefore, for the minister to get serious, the funding bit of it must be put right.
Thank you.
Thank you very much.
Yeah, colleagues, most of these were comments. There were no specific questions to the minister. So I don't want to disturb her again going on in the floor to repeat what she had said, but I'm sure she has noted and see she has taken notes. So this is an information paper for noting and also the committee to look at. But I think it would be a good practice whenever we are going to have such an international days for the committee to come and give us a report on the floor, an independent report which we can own as a house, so that once the minister is coming,
Brought to you by Roofings, Strength of a Nation. Brought to you by Introducing the all-new Roofings TMX 500C rebars with cut and bend surfaces. Roofings, Strength of a Nation. Brought to you by Roofings, Strength of a Nation. Brought to you by